A lot for the introduction, and what I'm going to try to do in the next 15 minutes is to provide an overall picture of translational pathways and avenues for the validation of renal denervation therapies, a field that is aggressively growing with already a lot of activity with different type of technologies, techniques, and imaging modalities as well. So by disclosure statement, we do validation work for several strategic companies, many of which listed here have renal denervation technologies. So one of the first things to talk about is about technology definition, as actually it defines the experimental evaluation strategy. And one of the first things is safety, especially for regulatory purposes, and that has to do with the way the energy is delivered. If it's an internal source versus an external source, both type of technological approaches actually have different degrees of complexities and challenges. Therefore, the preclinical or experimental pathway here should be focused on energy delivery and toxic levels, delivery system performance, vascular injury and response, and non-vascular renal effects. The second main question is actually about efficacy, and efficacy, as you may know, is very difficult to interpret at the experimental level when you actually use healthy animal models. Therefore, there has to be a transition between the experimental data and actually the data that is collected in human clinical studies. And when you're talking about efficacy, you should actually focus more on procedural success, ablation efficacy, the nerve density, long-term efficacy profile, and neurohormonal changes. There are many companies, actually, I said before, and the complexity of this field is that every single technology brings a different type of flavor, technological approach, energy type, energy levels, polarity, and so forth. Therefore, it's actually relatively difficult to standardize a way to analyze the safety and efficacy of these technologies using a single model. One important part of the evaluation is catheter performance, and this is something that actually people tends to forget. Renal artery disease in patients and hypertensive patients, especially the ones with refractory hypertension, are not nice, big, straight shots as we usually see at the experimental level. Porcine arteries are usually straight and free of disease and slightly smaller. And human arteries in hypertensive patients are usually tortuous, diseased, and difficult access. So the experimental testing may not reveal the true technical deficiencies of the catheter that you're